Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Insulin. Insulin is actually a 51 amino acid peptide. This insulin is discovered by Banting. It is discovered by Banting and West in 1920s. And this insulin is actually synthesized as a pre-pro hormone. It is synthesized as a pre-pro hormone in the beta cells of pancreas. Okay, and then this pre-pro insulin gets converted into pro insulin, which again gets converted into the actual insulin. Then if you see the mechanism of action of insulin will mainly bind to an autophosphorylation receptors. So what are these autophosphorylation receptors? So insulin will bind to the autophosphorylation receptors, which are nothing but the tyrosine kinase receptors. Okay, and thus once it binds to the tyrosine kinase receptors, it will increase the expression of GLUT1 and GLUT4 expression occurs due to insulin, right? And second, insulin also it inhibits the phosphoenol carboxykinase enzyme. It inhibits the phosphoenol carboxykinase enzyme, which is a part of enzyme in gluconeogenesis. Thus it decreases the gluconeogenesis. Okay, similarly insulin also inhibits the phosphorylase, which is present in the muscle and the liver. Thus phosphorylase is the enzyme which is present in glycogenolysis. Thus because it inhibits the enzyme phosphorylase, it also decreases glycogenolysis. Then right, then human pancreas, if you see the human pancreas, it contains 8 milligrams of insulin, and this 8 milligrams of insulin is almost equal to 220 units of insulin. It is equal to 220 units of insulin. Actually, if you have to see the conversion units, 1 milligram of insulin is equal to 28 units of insulin approximately.
thank you and thank you for watching.